There's a quiet revolution in American medicine. Healthcare with a human touch.
I'll give your handout middle.
Our patients are really asking for us to drop our equipment, put down our prescription pad, take off our stethoscope, and just listen.
Next, RX, the quiet revolution. I didn't expect to find David Loxterkamp riding a scooter. After all, he's a doctor, like my father was. And my father never rode a scooter to make a house call. Matter of fact, it was curious that David Loxterkamp was even making a house call. How many doctors make house calls today? My father made plenty of them when I was growing up. But that was in the 1950s, more than half a century ago. This illustration by Norman Rockwell stood on my mother's bureau. It was her idea of what a doctor was supposed to be. Warm, empathetic. He delivered babies, set broken bones, and carried a crinkled black bag filled with medicines that could relieve pain and cure illness. A lot has changed since then. Miracle technologies and wonder drugs replaced Doc Rubin's black bag. But as my father prepared to retire, he was dismayed. He had lost faith in our healthcare system. I don't have enough time for my patients, he told me. They're paying more, but they're not getting their money's worth. He didn't think much could be done about it. He had never met anyone like David Loxterkamp. David is on the cutting edge of a quiet revolution that promises to transform the way we receive our medical care and lower the costs at the same time.
We've been trained exquisitely well in medical school to fix what can be fixed. You know, when we know what the problem is, and there's a solution to that problem, and it's a technical solution. Boy, we are good and we're fast and a little expensive, but we are definitely, top in the world. You know what? Your heart murmur is actually less than it used to be. It's very quiet now. But we think that we can fix everything. Well, we really can't. Many of our patients are really asking for us to drop our equipment, put down our prescription pad, take off our stethoscope, and just listen. Is that any better? Not really. We face people with chronic illness. And the hard part is these chronic diseases really depend upon the patient to take control. This is where the doctor fixing patients runs its course. And so my job is to help them realize a lot of this is in their power. A lot of this is up to them. So I asked your mom earlier what book she was reading now.
Before I set out to make this film, I was, like my father, afraid that healthcare in America had taken a wrong turn. It was too expensive. It had lost the human touch. But watching David with Florence Tao was the beginning of a journey across America where I met a new breed of healthcare providers, creating cultures of respect and inclusion, affirming the connection between community and wellness, and doctors, nurses, and medical professionals of every kind putting the patient center stage.
If you have a target on the wall, and what you have in your hand is a rock, you can throw the rock at the target, and eventually, through practice, you can make the rock hit the target every time. I'm active, the rock is passive, I exert my will on the rock and make it do what I want, which is to hit the target. But if I have in my hand a bird, and the goal is for the bird to be at the target, I can push the bird with some force, I can aim it and push it towards the target. But whether the bird ends up at the target is almost completely dependent upon whether the bird decides to fly to the target or not. Now, if I put a bird house and some bird feed and its bird babies on the target, now it's way, way, way more likely that the bird will actually go to the target. Why? Because I spent time understanding what was important to the bird. And I put things of value to the bird at the target that the bird cared about. This is healthcare. People are more like birds than rocks. They have will, they make their own decisions. My job is to influence the bird or the person to get to the target.
Health Center. This is Jamie. How may I help you?
Was there any loss of consciousness or visible injury, or was she complaining of an injury after that?
David Loxterkamp has been practicing medicine in the same small community for 30 years.
Yes, can I get medical records, please?
His father was also a doctor in a small town in Iowa where David grew up.
We're having a party, huh?
Like his father, David wanted to practice alone, but he changed his mind. Today, he works as part of a team.
You see that? Oh, it's got that little divot in there?
Yep.
Doing what my father did for the first 20 years of my practice, I realized that medicine is too difficult to do alone. This is a really hard, emotionally draining job. You really need someone else to help you out.
Hey, buddy, how's it going?
Doctors, nurses, medical assistants, a psychiatrist and a psychologist, a physician assistant, a pharmacist and a physical therapist. A team, providing resources for patients and support for beleaguered doctors eager to make more meaningful connections with their patients. David and his team confront challenges that healthcare providers all over the country face every day.
Dan and Sharon are coming in today just for medication refills.
Right. I stopped giving refills because they didn't make their appointment. So that's why they're here.
So they're being coerced to come in today,
Yeah.
so that we can have a look at them and maybe talk about whether they're willing to take care of themselves or not. You are not so much for using the doctor, are you? It's not your favorite thing to do.
It's not you.
Yeah, I know it's not me, but so maybe what we could do, since it's been a little while since I've seen both of you, is we could get some testing done today and then have you come back and go over the test results. Would that be okay? Would you be willing to do that?
Does it involve needles? I don't like needles.
I know. Well, testing does involve needles. One needle, but several tubes of blood.
You gotta do what you gotta do.
Okay, very good. So Dan, I'm going to get back to you. So what's been going on in your life since I last saw you?
Just been getting our firewood in, mowing the grass, been busy.
Yeah. Do you do any driving?
Oh, no taxi driving anymore, no, not for a long time.
What happened?
This leg right here, if you remember, it swelled up.
Is the leg still swelling, or is that better?
It's still a little bit, you can see right here.
Okay, not well when I, oh yeah, that's pretty tense. That's pretty full.
Well, you ought to see the inside of it.
Okay, so would you mind showing me that, like pulling that up a little bit?
Rather than we get it. Oh, that, I don't know what's causing that. You tell me what that is.
Well, that's a huge ulcer.
No, it's not that bad. It don't bother, really.
Well, it's all the way through the layers of skin. Yeah,
What
that's,
can you do about it?
well, we need to wrap it. We'll try to do that today. It also feels infected to me. Feels warm and infected to me, so that we're going to put you on antibiotics for that.
Okay.
And I'm going to need to measure that so we can know whether it's getting bigger or smaller. How long has it been this way?
I really don't remember.
Okay. These kind of ulcers can lead to really serious problems that you don't want to have to address. The other key factor here is we've got to get your diabetes under control, because if it's not under control, this doesn't stand much of a chance of healing. So we'll look at this until it's healed. We'll follow this until it's healed and get you back. You know, early on, I felt like once I really knew medicine, it would be a lot easier. Once I really kind of, knew what to prescribe, how to diagnose, what tests to order, it would be pretty simple. And it hasn't gotten that way because people are complex. Tell me about your diet. Let's hear a little bit about what you're eating.
Just the usual things, I guess.
What are you going to have for lunch? What do you normally have for lunch?
Whatever, I don't know.
Usually sandwiches. Sandwiches, like last night he made pork chops and tater tots. We had that.
Anything green?
No,
No.
we're not rabbits.
So David, what is it that you like about making house calls? I didn't think doctors made house calls anymore. Well, and my coming is an expression of another way of saying I care about you and I care about what's going on in your life. What do you learn about the people from visiting their homes? Good things, bad things. I sometimes learn how lonely they are, how few people come to their home. Maybe the stresses that their caretaker is under, what they eat, what's on their shelf. I get a sense of how they spend their day, whether they're in a chair all day long, whether things are tidy and picked up and they're looking after themselves. Most doctors are going to say that they don't have time to visit, that they're too pressed, it doesn't pay. How do you make it work? The bargain I make with patients, I think the bargain we all make in the practice, is that I'll see them in the office when they can come and I'll see them in their home when they can't. Well, I'll tell you, one of the things that this reminds me of is my father, who also made house calls, but it was such a different era. It was 50 years ago. Right. My dad made house calls in the afternoon from, like 1 until 4 in the afternoon.
He would see patients late in the morning, then he would go back to the office late in the day, but in the middle of the day, he was out making house calls. And I have to say that one of the reasons why he did it, or at least I was told this by one of his colleagues, was that he could charge $3 more if he made a house call than if he saw them in the office.
My father was working way too hard
Yeah.
to have time for his family to do some of the things he wanted to do, but that was what was expected then.
And working Saturdays and giving up vacation time was all expected in those days. And they lost track of their families in many cases. But I don't want to dismiss the fact that my dad worked very hard so that I could choose where I wanted to practice and how I wanted to practice. And it would have been a source of great pride for me to have practiced a few days with him and to show him what I'd become. Good to see you. Your mom's inside?
Yeah.
Okay. How has your diet been in terms of the diabetes? Tell me about that.
Well, it's been pretty good.
Yeah.
Yeah.
Cutting down on carbohydrates?
Try to, yeah.
Starches? Uh-huh.
Yeah.
Yeah. Do you get much in the way of fruits and vegetables?
I get a lot of vegetables. Like we have, yeah. I've had oranges and apples.
Good. Fantastic. How's the weight?
I don't have any scales. Never have.
Okay. All right. At some point, I won't...
Where did you come from?
She wants to get in the action.
Yeah, right.
At some point, you'll be coming back to the office, and I won't be
Yes.
coming out here. And so when do you
Yeah.
think that's going to be? Are you feel ready for that now?
I think that probably the next time that I have to come to the office, I can come.
Fantastic. That's going to be your challenge, is
Okay.
to get up and move around.
Yeah.
And coming to town is one way of getting up and moving around.
Right.
Okay?
Okay.
Good. I'll help you with the diabetes and the blood pressure, and you help yourself with more exercise.
Yeah.
So the next time I see you will be in the office.
Okay.
Okay? Good.
Yeah.
That's right. That's exactly right. The opportunity for cure comes few and far between, in the actual day-to-day practice of medicine. Most of my patients coming in, if they have a disease, it's a chronic disease. It's a disease whereby what they do for themselves and what they're motivated to do for themselves matters far more than the pills that I give them or the advice I offer. It really becomes up to them to take care of themselves in the ways they know how best to accomplish. Nearly every day, I'm reminded of my limitations as a doctor. It's a tough job, and it really is a blow when you miss a diagnosis, when a patient goes into the hospital because of something you omitted or you committed. It hurts. They're patients I have known for 30 years. So to be able to come together with my colleagues to support each other is really, really important. And what we've tried to do in our practice is develop a small community that nurtures itself just like it tries to nurture the patients who seek our help.
I've been thinking a lot about Jason and his passing, and also just trying to process, the emotions around his family sending me flowers and a card when he died.
Oh, that's lovely.
And he's a 39-year-old guy who is probably the epitome of the failure of our healthcare system. Who I saw less than 24 hours before his death. And he said to his father on the way out that when I finished practicing medicine, he was done with doctors.
Wow,
And he died the next morning. And, I just, I'm kind of filled with oh my God, what did I miss? And, feeling like there's no way I deserve that kind of gratitude. He suffered this cascade of illnesses from his 15 years without any diabetic care. And, he got osteomyelitis in his foot, and then he got endocarditis from that infection, and then he lost his heart valve and had a heart valve replacement. He had a hypertensive crisis and blew out both his retina, and he eventually lost his leg. He's kind of an extreme example of, somebody who got lost in the shuffle when he was 18 or 19 and lost his coverage and then did nothing for so many years.
Mm-hmm. It's really, the hard thing about doctoring is that these failures of the healthcare system always seem like personal failures too, don't they? I mean, we all...
Yeah.
You see all that can't be done or hasn't been done, and yet you also feel a personal responsibility for that.
Well, and just I couldn't fix all those big medical problems, but just, the quality, I felt personally responsible for the quality of his life.
David's practice has proven effective. Numbers tell the story. A third of the patients in his smoking cessation program have quit smoking. emergency room visits have dropped 40% in the last 4 years. And last year, the blood sugar level of patients with uncontrolled diabetes dropped 100 points.
I don't leave my home when I go out on a run. It feels like Belfast is a big home. I know where my friends live, and I know where my patients live. They also know where, there was an accidental death or there was a suicide. I know where there's been tragedy in this community. For me, health has always been in the community, not in the hospital, not even in my office, but in the community, in the places where people make friendship, where they have their families, where they work, and that's what motivates them to be well. They want to live, they want to experience, they want to be alive. And when they're sick, they lose that, they lose those connections. I thought I knew this community, but 10 years ago now, we started seeing patients with opioid dependence. And it was quite a surprise to me.
I'm gonna try and stay away from that for a while, but I just basically heard someone rattling a little bottle around, and I'd already had a drink or two, and I didn't even have to ask for it. And I just ate some sort of painkiller. I don't really know exactly what it was, but...
We kind of talked about that, didn't we? That when you're in a really good place, you let your guard down.
Yep.
Doctors all over the country have been surprised to find themselves confronted by an opioid epidemic.
I think. Really don't. I still
Every
feel
hour,
good. I mean,
one American dies from an overdose of painkillers.
Doesn't feel good, and I feel bad about it. It makes me feel guilty and stupid because, I don't know. I feel like I probably could have been a little stronger, but had I not been drinking, I would have been a lot stronger, but...
Right.
That's the thing, isn't it?
Yeah.
I know I had a slip, so I'm relating to how you're feeling.
Yeah.
Like I've let not only myself down, but my group, my kids. I mean, it was like a big...
David's practice responded to the crisis with a medically assisted recovery program using Suboxone, a drug which tamps down the persistent craving for narcotics while easing the agitations of withdrawal.
If you were to ask everyone just joining the group, they would say definitely the Suboxone normalizes my life. But what we hope they will discover over a period of time is that it's the group itself that is really what promotes their recovery.
I knew there was occasionally marijuana there, which...
When you start feeling really negative about yourself, you have the group reminding you that you're only human and you do mess up and all you can do is start over. I had to do it. I've done it myself. I've had, slips and had to come back and and be honest. I think the biggest thing, you have to be honest with yourself and you have to be honest with others in order for recovery to truly work. And the group helps you stay accountable.
Have you used it all since rehab?
I've had a couple of slips, yeah. Not bad ones, but yeah, there's been a couple of times I've tried it just to see.
So you should be here. Because I've been wondering where you were, and if you've been this vulnerable, you should be here.
Right. Well, and I couldn't get here. And, everyone said, we're going to make sure you can go to meetings. We're going to make sure this, we're going to make sure that. Tuesday night comes and nobody will help me.
How did you get here tonight, Trish?
Tonight, Keith finally has the kids, but, sometimes he can't take them and they don't help me. They said they would and they don't. And I ask, what can you do when they say you need to ask for help? And I asked for help and they all say no. So, and then sometimes they, I hear the comments they make about having to take care of me. And they're just joking, but it's hurtful.
This is why I think it's so important for you to get the help outside of your family, So the first
The
step,
support system in this Suboxone group is incredible. I love these people here dearly. They saved my life, or they gave me a life. They didn't save my life, but they gave me a life.
I think getting the support you need, talking about what's going on in your life is really important for you. It's really important for us. We saw people coming into our practice who needed help. And what really matters for these people is the community that gives them a reason for wanting to be better, for wanting to restore their health. And without those reasons, they don't buy it. They don't want it. I'm seeing both of you today, right? Yes. Okay. And you're sitting in the driver's seat here, Danny, so I guess you go first, huh?
Yeah, I guess.
Yeah. How long have you been sick with this cold?
At least a week.
Yeah.
That's why I got this thing on.
Uh-huh. How have you been, generally speaking, other than this recent illness? Have you? Mm-hmm. Have you been checking your blood sugars?
Yeah, I haven't for a few days, so.
When you've checked it, what are the numbers averaging?
Oh, God. Yeah, a couple of times they're a little high, about 2-something, but most of the times they're under 200.
Under 200.
Right.
And you're still taking
I forget what I got. To be honest with you, I forget what I got. I know I got the metformin,
Yeah.
the little round green ones, and the big G word one there. Yeah, well, however you pronounce it.
And you're taking the metformin twice a day?
No, it says once a day, I think.
Okay. I think we're kind of getting confused here on some of your medications.
Yeah.
And they won't work if we don't have you take them properly,
That's
right?
right.
So what I'd like to do today is recheck your blood and see if we can get that. You know, I'm not sure that it's going to be much different from last time since you've not really been taking the medications the way I'd hope you would.
Yeah.
So before you leave, I'm going to...
The idea of collaborating with your patient sounds very good, but what happens when the patient can't fulfill their side of the bargain?
Sometimes it seems that the patient is failing the partnership, but I may have misunderstood what they wanted from me. I have my agenda, they have their agenda. Very oftentimes they don't directly overlap. So their failure to be compliant, you know, that's a medical term for them doing what I want them to do. Their failure to be compliant may come from a lot of different, for a lot of different reasons, most of which are exactly why they're in the fix they're in to begin with. You know, why they're diabetic, why they're a smoker, why they're overweight. All right, I'm going to have you two change places, okay?
I don't want to.
Well, I'm sorry. You're going to have to get on the hot seat.
My feet just barely touch. Oh, that was little bones creaking.
Yeah.
Now I'm on the hot seat.
There you go. And so it's a dance. It's a negotiated, you know, sideways stepping to the forward progress that we both want. Sometimes we take detours, and I ask for things they can't do right now, or maybe never do. So let's find a different goal. Because if people can't lose the weight, and if people don't get the exercise, then they end up in the hospital for the expensive procedures to replace their shoulders, their knees, their hips. Danny, you've gained 3 pounds since I saw you last.
Shh. I hate scales. They're my enemy.
Uh-huh.
You think you're sitting on?
That's right.
I know.
That's the good news, is that we now have a good weight on you.
You don't want it. It'll break them.
The last time I saw you, we put you on some pain medication because you were having a lot of pain. Are you still taking that pain medication?
Yeah.
And the reason why I gave you that pain medication was so that you could become a little bit more active, a little bit more mobile. Do you and Danny go for walks?
No, not lately. We haven't, but, you know.
It's the one thing that really can help. You know, I know that weight is an issue and not easy to lose. The thing I would really encourage you to do is work on the exercise, work on the activity. And if you can, you know, after you've taken the pain medication, if you can go out and walk a little bit, that would be great. What do you think about that?
And when I feel, you know, my back don't kill me too bad, but I don't, you know, I know it's between the weight, you know, the way my back hurts, but it's just, it's so hard to lose. It really is.
Yeah, and again, my preference would be not to worry about the scale, but would be to worry about the exercise and to make sure that you're making an effort to, the both of you, really. Danny, for your diabetes and you for your weight. One of the things that we could do, and I've been thinking about this in anticipation of your visit today, is having you get hooked up with Bart, the physical therapist here in the office. Would you?
I have to think about it.
Okay. Sometimes my frustration they pick up on. They know when I'm pushing too hard, and they have their own reasons why that's not a good idea right now. So it's really a lot of people who need to get involved from time to time. Physician assistants, therapists, physical therapists, behavioral therapists, psychiatrists, dietitians, lots of people. Fantastic. Okay, so you have longevity in your family. So these are, you know, this is a good side of the equation. The bad side is getting you off your seat and out walking. You know, you need to do that. I keep harping on this, but, you know, it is important. Hope you can do it. Give it a try. And then we'll see each other again. We do have to set the stage that this is a cooperative venture and that their decisions are more important, really, than my decisions. I've often felt this, David, that the patients who are capable of eating the right foods and getting exercise and doing all the right things, they really don't need me. The challenge is for me with those patients who are complicated, who have difficult home circumstances, who have conflicts in their life. I may be the only person who talks to them today with a friendly voice and cares about the outcome of something they've done. So I want to be the person who helps them get to that next step, even if it's a very small one. I want this one success to play into other successes in their life that are probably more important down the line. But it begins with a relationship that then leads to encouragement, leads to a professional kind of friendship, and leads ultimately to mutual goals toward their better health.
There is no place in America where chronic illness is more prevalent than the Mississippi Delta. And so I traveled south to one of the most impoverished parts of the country, where diabetes rages out of control. Annie Ford has lived with diabetes for 12 years. Until now, she despaired of ever getting it under control.
I feel that I was giving in to diabetes. But if you want to be successful, you got to fight. So my thing were, I'm not going to let this get me down. I'm going to get it down, but it's not going to get me down.
Amen. You'll give it back, amen? I just want to stop and Sister Annie just give her a minute just to give a little insight on what's going on, and we're just going to give her a hand clap of praise that she's doing.
Thank God for y'all, because y'all have helped me, and I want to help somebody else. As you know, a lot of us out here have diabetes, but we don't know the meaning of it. I have it, and I've had it for a long time. You can live with diabetes. You don't have to die. You don't have to be on dialysis. All you need to do is do the right things for your body, because you can't go wrong. God sent somebody in my life to help me, and they are asking me to reach out to people. If you know somebody, tell them to call me, see me, go to Louisville. Tell them Annie sent you, Annie Ford sent you. They'll know why you were there, and they will help you.
Ruleville has less than 4,000 people. But it is the epicenter of healthcare in this part of the Delta. Ruleville's Sunflower Health Clinic is open from 8 in the morning until midnight every day of the week. What kind of health problems do you see come to you?
Diabetes is one of the largest challenges. We have more diabetes than any other state. And we see a lot of children who are malnourished. Once that malnourishment goes away at about 5 or so, then we start to see overweight and then obesity. About 40% of our children under the age of 18 are considered obese. Staggering.
Hello.
But Ruleville is participating in a study funded in part by the state of Mississippi to help diabetics manage their precarious blood sugar levels.
Now, do you want to stick yourself, or you want me to stick you?
I would prefer that I will.
Okay.
I'll probably stick myself.
There you go. So we're just going to put that little...
After Yolanda Downer was diagnosed with diabetes, she joined the study and was introduced to the Ruleville Clinic's technological partner, the electronic communication tool they call a tablet.
Your measurement has been recorded.
And what this is going to do is it's going to send the information to Jackson.
Yolanda's blood sugar levels travel in an instant from Ruleville to the Center for Telehealth in the state capital in Jackson, 120 miles away.
Now today, Miss Yolanda has already started out at a blood sugar of 318. And that's where a lot of people with diabetes kind of live, we call it. Diabetes is kind of a quiet disease. There's many times you're not even aware that you have diabetes.
If Yolanda lives with 318 for a long, long time, what happens?
She will have kidney disease. I mean, we know that it will happen. It's not a matter of when, it's a matter of how bad. And every morning, I check all my patients, and if I see Yolanda's numbers getting higher and higher, then I make a phone call and say, you know, what's going on with you? What can I do to help you? The purpose of this is daily intervention, so we can catch things before they become problems.
The center was conceived by Dr. Christy Henderson while she was working as a nurse in a Mississippi emergency room.
During that time, I started seeing patients from all over Mississippi. Small community hospitals had sent patients to us for higher level of care, and the outcomes weren't always great. And we knew if we could do something sooner, that we might impact their health. So we started devising this plan around telemedicine on the back of a napkin, just drafting up the concept for several years.
Today, Telehealth serves more than 100 Mississippi locations, including Ruleville. Do you have Miss Annie Ford's numbers there?
Yes.
Is she going down?
Yes, she today, I will show you, was down to 87. So she is right on target. That reduces her risk of all those dangerous complications of stroke, heart attack, blindness, severe kidney disease. She has just changed the trajectory of her disease process.
This is tough. You've got to change your whole life, how you eat, how you exercise, what you think, that's been generationally trained. That's not going to be a quick process because it's not take this pill and do this and it's as easy as that and it's controlled or gone. It's not. It's for life.
Hello. Touch a drop of blood to the end of the test strip until the meter beeps.
Do you do this every morning, Ann?
Yes. It wakes me up with a little sound goes ding, ding, ding. You get up and it tells you what to do.
Wait while your measurement is recorded.
I can't go to see the doctor every 5 minutes, but I can do the tablet whenever I feel like it. Okay, here we go.
There are two main types of diabetes. If you have type 1 diabetes, your body is unable to produce sufficient insulin.
And I have type
If
2.
you have type 2 diabetes, your body does not produce enough insulin.
I didn't know I
This
was
condition is
a
called
diabetic
insulin
person
resistance.
for years, I
The
guess.
main
I had it,
symptoms when
didn't know
diabetes
it.
starts are the same, whether you have
And
type 1 or type 2.
I didn't know what to do because I know there should be something that you can do or you can take to help make it better. And I just kept saying, Lord, what can I do? Who can I talk to? Where can I go? I know the next thing is dialysis and kidney failure. So I'm going to be honest. I prayed because I was afraid.
You should be aware of the effect
Because at one point I thought, don't nobody care about people with diabetes. They just send them to the doctor and the doctor tell you to take your medication, come back in 3 months, I check your liver, I check your kidneys, and boom, that's it. I mean, you ain't got no teachings of what to do, how to do, what to eat, what not to eat, what to exercise, how. You don't know anything. You just as dumb as you was when you went in. So you need somebody that cares.
Let's talk about Miss Annie Ford.
When I met with her, she was not taking her metformin.
We discuss each patient in a team call every week.
So I walked her over to the North Sunflower Pharmacy and
No amount of technology can replace that human aspect.
there, and they got it covered for her.
Well, that sounds good.
These are our patients. They've been our patients for a long time. They know us. We know them. They live in our community, and we care about these people.
Could you please take a deep breath?
Somebody said to me, you know, they have a tablet here. Why do they need doctors?
I think both needs to be helping each other, doctors and the tablet. The patients have responsibility now. It's not just like I give you the medicine, that's okay. But now I give you the medicine, let's see the result. The tablet is very part of the team, no doubt about it. No doubt about it.
Kathy didn't just hand me a tablet and say, here's a tablet. Because if she had of, I don't think I'd have stayed in the program because then my trust that I already had in her wouldn't have been because you don't care. You just want to give me this and go. But she sit here with me and went over and over and over. That way, I know she cares.
Have you ever felt like dizzy, shaky, sweating, feeling your heart going fast, any of these symptoms?
Not recently, no.
Annie's healthcare team extends all the way to an endocrinologist in Jackson, a 2-hour drive.
When your sugar gets high, how high is it to be dangerous?
You know, your body, as with anything, also gets used to your sugar level.
I don't have to go to Jackson. They'll set it up to where that when you go to the clinic, they'll put the doctor on the monitor and you on the monitor. And I talk to him just like I'm talking to you.
Some people who are unfortunately not very well controlled always have sugars running in the 400s.
There is not a diabetic specialist in most of these communities. It's hard enough for all of us to go to an appointment when it's down the street and you have health insurance and you can take time off from work, but take that away for the average person, barrier after barrier after barrier, one more reason for them to not go get health care.
Are you beginning to get some data from the study?
We are. First is that we've not had a single patient go to the ER or be hospitalized, and that's dramatic because these are uncontrolled diabetics. We are also seeing glucose levels come down, so it's a dramatic change, and that's exactly what we want to see.
So ER visits are falling.
Correct.
Glucose levels
Falling. My hope is that not only will I be able to expand this program, take out diabetes and add every chronic disease, but add every single county, and that we're doing this at a statewide level.
We're tired of being first in the nation in obesity and diabetes. I know I am. I'm tired of it. We're better healthcare providers than that. We just have to find what works here. And I think if we find it and fix it here, it can be fixed nationwide.
Controlling your blood sugar requires a balanced diet.
Dark sections, vegetables, crackers, snacks.
A decision to take a medicine, to eat healthy, and to exercise is an individual choice. And we want to make that easy and support that effort.
Why do you think you succeeded in getting your blood sugar down?
Because I care about me and I wanted to do this. And I knew if I got help, I could do it. If somebody cares about you, all you got to do is care about yourself.
You give an answer, it's going to
The way to control this disease is with constant communication with our patients. Give them responsibilities and accountabilities, and we have accountabilities and working with them.
With this program, I feel that I can get off the medications. And I'm still striving to get to the top. I'm not there yet, but I'm getting there.
There's no cure for old age, and Americans are getting older. In the next 20 years, 72 million Americans will be over 65, twice today's number. What's going to happen when so many elderly people can no longer live on their own, when they need nursing home care? My mother told me that she'd rather die than go into a nursing home. Most Americans feel the same way.
I like independent. I do everything very, very independent. Even looking at my son, I never ask them help me. They take care of me too. But I know they are very busy.
I just can't see myself in a nursing home. I think that there's a lot of lonely people. I don't think I could handle that situation.
In the heart of San Francisco's Chinatown, there is a place called Unlock, making it possible for aging seniors with chronic illnesses or disabilities to grow old in their own homes.
We are able to provide an alternative during the day for the person, you might call it daycare, and bring a variety of resources into the home.
You are living here all alone. What do you do here?
I'm so busy. I like study. I like writing. I like read newspaper. And I like sing a song by myself. Because that makes me relax and happy. So happy make me health more. Twice a day, home care come and help me do some like a vacuum or do the laundry or shopping for me.
Without Unlock, our participants would be in a nursing home almost without a doubt. We take care of diabetes, we take care of kidney failure, we take care of very fragile, weak, elderly people. Now, it involves a risk, but we partner with people who want to accept that risk. They want to stay at home so much that they're willing to accept that risk.
They take care of all my food. Never have to grocery shop, never have to do any preparation. They give me all my medication, morning and night. They take care of everything. There is a lifetime of memories in this room. And there's a little story that goes with each thing. I had a partner, and a lot of this is his stuff too. He had a heart attack, and he just like that. It was a very traumatic experience to watch your significant other pass away right in front of you, and just so suddenly, without any warning. I had no clue what I was going to do. There was no plan. It's not something you give a lot of thought to. You don't plan your life out to what you're going to do if you lose your significant other. What if everything changes for you. I never really thought about doing anything else but living here.
Onlock means peaceful abode. It got its start in San Francisco's Chinatown in 1971. Today, Onlock is part of a nationwide program called Pace Lifeways, serving a variety of ethnicities. But in San Francisco, most of the participants are still Chinese. Before 1970, there was no alternative for elderly Chinese when their health deteriorated. They had to say goodbye to their own homes and enroll in nursing homes far from their neighborhoods.
There's a lot of nursing homes in the area, but we found the language and the culture was very different. In those days, when people go to a nursing home, mostly they will not last through enough for a long period, either of isolation, depression, and they just give up.
The Chinese community started out wanting to have a nursing home that served Chinese food. Very simple. But the more they talked with the elders, they realized they don't want a nursing home at all, even if it serves Afghani food. What they wanted was to be at home. So the community tried to solve the problem.
There is one place in this country where the very sick elderly can have it all. It is a place called Onlock, right here in San Francisco.
And it is designed to keep the very sick elderly out of nursing homes and in their own environment. Onlock gets a lump sum of money each month per person from the state and the federal government. It's allowed to spend it in the manner it thinks is most appropriate, whether it's for in-home care, rehabilitation, at the day treatment center, or whatever.
The state says, we'll give you less money than we would normally pay for a nursing home. And the federal government says, we'll give you less money than we would normally pay for the health care of somebody in a nursing home. And you combine those two streams of money into one bucket, and out of that bucket, you do whatever you want. You can provide whatever you think is necessary to keep the person at home. But if they do need a nursing home, it's on your dime.
And you are responsible to take care of the people.
That is true. Yeah, we don't replace the family. If there is a family, we're augmenting the family's caregiving. But it's in a way that difficult, people who have a lot of things that aren't going well for them get the care that they need. We're able to actually see improvement a lot of times. People come to us and we actually help them to be better. They live longer.
It's really a kind of catch-22, isn't it? Your mandate is to care for people who belong in nursing homes, but you're responsible for keeping them out of nursing homes.
Having them go in, Onlock pays for that. We're at risk for that. So that's our failure, in a way, right? That we didn't, we couldn't keep Mrs. Chong out of nursing home. It's just interesting. It's a whole different way. I don't make more money, by the number of visits or nothing like that. I get a fixed amount. That's it.
I mean, American medicine is based on fee-for-service.
Right.
Not you.
Right. Not at all. No.
Emergency room care is very expensive. Hospitals are very expensive. So, how do you compare to nursing homes when it comes to keeping people out of hospitals?
A nursing home is more likely to send somebody to the emergency room than Onlock. A nursing home is also more likely to hospitalize someone than Onlock. And when a nursing home puts somebody in the hospital, it's more likely that they have to go back to the hospital in the next 30 days.
Although Belle Lynn gladly lives at home, she travels to an Onlock Senior Center for activities and companionship. No one wants to be lonely. But the center is more than a meeting place. It's action central for a team of healthcare providers.
Belle joined us in 2011. She actually had a stroke about 5 years prior to that, and she had been having some falls at home. She also has chronic pain in her neck and her back. That was how she came to us. Since she's been with us, I would say that generally, medically, she's been pretty stable, which is great. Her chronic pain, we're really managing it without much medication.
Back in April, she actually attended our chronic pain management class. We have a series of 5 classes, 5 weeks, and then she really benefited from it.
Like all the seniors under Unlock's care, Belle has her own doctor, along with a team of healthcare providers, nurses, dietitians, physical therapists, psychologists, meeting every day.
We discuss problems that have occurred overnight. Perhaps somebody fell, perhaps somebody was in an emergency room, perhaps somebody's condition has changed so that they need more help or a different care plan. That's when the team puts their thinking caps on and comes up with a team strategy.
She was really sort of reluctant to enter like a formal therapy, a relationship with me. She just has some underlying anxiety, and she doesn't want to talk about it sometimes, just because I guess for the Chinese culture, whenever we talk about mental health, anxiety, depression, it brought shame and a lot of stigma. So I just basically follow her lead, and eventually just got like talking with her and help her find ways to kind of express and release her anxiety.
About the anxiety, she's one of the first participants who I developed a quick relationship with. She talks about her different color nails. Once a week, the nails are usually a different color.
Basically, like what you did, comment on her nails and how pretty she looks, and comment on how strong and how positive and the life experience that she had, and then just help them focus on their strength.
There's no question there's healing that comes from empathy, and there's healing that comes from addressing the emotional and spiritual needs of people instead of simply trying to get their blood tests to all line up in the normal range.
My father was a great schmoozer. He'd spend way too much time with the patient. My mother was always upset with him.
Well, I think that one of the great things about providing personalized medical care is actually knowing the history of the person, knowing their life experiences that you only get from schmoozing. The old-fashioned doctor did hold your hand. They did share an empathy with you. They had what we would now call a bedside manner that many modern doctors simply don't have the time or training to provide. And I think one of the specialties of geriatrics is to bring that back, but not throw away the medical advances, not throw away the technology.
You see with me? You called me. I'll pretend.
My staff are more likely to temper the aggressiveness of the medical care appropriately based on the age and the frailty of our participants. I never am able to say to somebody, "You're young again." That would be great. But I feel a privilege taking care of people who've made it to their 90s and 100s and help them in their final years live with dignity and hopefully stay at home.
300六15个日子不好过，把我的爱情算给我。
3,000 miles from San Francisco, I visited a healthcare system in Alaska that is encouraging thousands of Alaskan Native people to take responsibility for their own health and put an end to suffering that has endured for generations.
We are, from the depths of our heart, trying to be healthy people. And it's not an easy journey. We've had a rough life and history. And the rising up right now is right here. It's right here, the brightness of what's happening.
I think we didn't know what we didn't know. First, we didn't know how huge an endeavor this would be. And we didn't know how terrified we probably should be in attempting wholesale revision of what was a model that had been in place for 100 years. But I said to myself, well, we couldn't screw it up worse than it is.
Over many decades, the health of the Alaska Native people had been entrusted to the Indian Health Service, the IHS, a federal agency unequal to the task. In Anchorage, the IHS attempted to deliver medical care to tens of thousands of Native Alaskans through a hospital emergency room.
If you had a broken arm, if your baby had strep throat, if you had a cold, everyone showed up through the emergency room. So if you can imagine, it didn't matter what day it was always jam-packed.
Yeah.
So how did you experience it from your end as a doc?
Oh, it was terribly frustrating. I mean, there was people that you would see that it was unlikely you would ever see them again. And you didn't manage them as individuals, you manage diseases and visits.
It was kind of just a classic medical model of you show up, you get seen in an exam room, you get a diagnosis and some medication, you go home.
Nobody wanted to go there. They weren't very kind. They talked about you like you weren't there.
Catherine Gottlieb, a Sukpiak Alaskan from a remote village of 100 people, would lead the sweeping changes that would revolutionize healthcare for the Alaska Native people. In 1987, she went to work in Anchorage for the tiny South Central Foundation. She began as a receptionist in a South Central dental office.
I had never run an organization, but personally, receiving care from the hospital, I knew inside my heart what people didn't like. So I went back to school, and I got my bachelor's and master's degree while working, and raising kids. I had 6 children, and eventually I became an associate planner, and then became the deputy director. And this happened within a period of 4 years.
Catherine and I and others at the time talked about kind of what would we do, what did we think would work if she and the Alaska Native community could just get their hands on the system and on the resources to make it happen.
The whole place needed to be changed. And what I felt was we could run that hospital. We could run the whole entire hospital.
In 1998, with Catherine as CEO, the South Central Foundation took over from the failing Indian Health Service. Native Alaskans were now responsible for their own health, owners of a healthcare system serving only Alaska Native people. Eventually, 65,000 of them across more than 100,000 square miles. Primary care became central to their mission.
What we wanted to do is develop a system where everybody's working as a team. So the likelihood that we're going to have a swing and a miss and have an adverse event is actually infinitesimally much smaller, as multiple eyes with multiple perspectives, with multiple abilities to adjust, all are looking at the same thing. If I miss it, one of my partners will probably catch it.
Today, South Central doctors are surrounded by pharmacists, behavioral psychologists, dietitians, and midwives, all sharing information in real time.
Now, I grew up with a father who was a solo practitioner, and in my father's day, the doctor really was the hero. His authority ruled.
And that comes with a burden, because all the decisions, all the outcomes, all the events that ensue are all on you. If you are the Captain Kirk, lead from the front, you know, whatever happens, it's all yours. You owned it, lock, stock, and barrel.
Hi, how can I help you?
Patients can get an appointment the very day they call, and there is almost no waiting.
Benjamin?
In time, South Central came to call their patients customer owners.
Customer owner was a very important concept for us to take on and to understand. We own it now. So we had to really change how we think about ourselves as Native people. It's different when you have no expectation. You just get what you get. Now we take responsibility to make sure you get to your appointment, because that's a resource, that you're prepared with your questions when you go there, that when you leave, you've got the answers that you need.
We're not just a patient. We're not passive. We're not people that we're going to be in there for them to do things to us, but we're going to do a journey of wellness together.
We should feel our heart working.
Catherine had no doubt that, you know, a completely customer-driven, customer-owned, customer-oriented system was possible. But bringing the medical staff along on this journey was going to be a challenge. You're trained basically to do diagnosis, treatment plan, and then sending them on their way. You give someone an instruction sheet and say, here, do this, and then you wish them good luck, and you ignore their existence until they show back up again in your office. The real journey, though, is what they do when they're at home.
I would come up with these complicated medical regimes for this drug and that drug, and then what we would do is we would mail them out to people in boxes every 90 days, you know, faithfully. And I went out one time, and I said, okay, well, show me how you're doing with your medicines. And they said, oh, yeah, no, they're all over here. And I said, okay, great, that's great. And what they took me over to is a corner of the kitchen as I went to their home, and they had 4 little boxes. And they said, no, that we saved them. And I'm like, well, it seems that these boxes are unopened. Can you tell me about that? And they said, oh, yeah, no, we have them. We don't, you know, it was a little complicated, so we just decided to save them. I'm like, huh. So I've been adjusting these microscopic doses of these different medicines and combinations, and they have been very faithfully stored on your kitchen countertop. Brilliant. So we said, these are only going to be effective plans if the people that we serve are fully engaged and committed to acting on them.
Alaska is vast, and there are few highways linking its villages. Only meandering rivers, twisting, turning, braiding their channels from the Canadian border on the east to the Aleutian Chain and Pribilof Islands on the west. In far-flung villages where there are no doctors, South Central works closely with community health aides.
Most of the villages are only accessible by plane, so community health aides are basically the village's healthcare provider. Often there's no EMS crew, and if there was a trauma, you'd need a medevac. So you'd order a flight into the village to pick up the patient and send them out. It can be really stressful. When I was the only provider in Nikolai, being on call 24/7 and having 2 children at home, it can be hard getting calls in the middle of the night and being pulled away and taking care of life-threatening, injuries. So that was why I chose to move to McGrath. I just, being under that kind of pressure for so long, you can only handle it for so long.
McGrath has 300 people, Nikolai only 100. And McGrath is served by a small South Central clinic with 2 healthcare providers.
Your thumb. Do you have any questions or concerns about her eating or her weight right now?
I don't know about concerns. She's having more formula.
And she's 9 months, you said, right?
9 months. She'll be 10 at the end of this month.
Okay. So just some developmental questions. Does she eat crackers?
Every community aide follows a strict protocol, carefully delineated in what's been called the Health Aides Bible, a kind of a cookbook providing a recipe for patient care.
Can she roll a ball back and forth to you? Okay. Whoa. Can she can she stand up holding on to something?
Yeah.
Uh-oh. This big manual that I have to follow, it basically has all the appropriate questions that you need to ask. And it has all these different sections in it related to skin, musculoskeletal, circulatory.
What is that? It looks like bruising, but I know it's not.
Has it been there since she's...
Yeah, since she's born.
You come up with your diagnosis and what you think you should treat the patient with, and then you call Anchorage and ask them, is this appropriate? So basically you're like the eyes, hands, ears, nose for the doctor who you're reporting to. See.
This is James.
Hey, James. It's Miranda. I just sent you a picture. If you would take a look at it and let me know what you think.
Sure.
I thought I saw some scarring on his eardrum, and I just wanted to run that by you and see if that's what you saw. The doctor will tell you this is what you should do for the patient, and they okay whatever medication you want to give or they think you should give. That order is put into our electronic health record, Cerner, and the pharmacists in Anchorage can see that.
McGrath doesn't have its own pharmacy, but hundreds of miles away in Anchorage, a pharmacist can fill a prescription electronically, and it will arrive at the clinic in an instant.
We have a big vending machine, if you will. Bulletproof and blast-proof. I also believe it's bomb-proof. And it's a fail-safe way to make sure that the proper medication is dispensed. A pharmacist dispenses the medication on their end through the computer, cues our machine here, and it spits out the medication. So you scan it, you pull the label off, put it on, walk it out to the customer owner. Therefore, we have a pharmacist on site in McGrath.
I'm related to probably 75% of the community, which can be beneficial for them. It can allow them to trust you more in the clinic. I'm familiar with their family history. You go to potlatches with them, you go to funerals, baptisms. I'm part of the community. I'm not going to call them out if they're sitting in the restaurant like, hey, you should be eating that cheeseburger. But you want to be honest with them, like, hey, I saw you, you can do that, I think, here. But you kind of have to meet the patient where they're at.
Now, last week we did 30 minutes, all right? So today we're going to advance it up to about 35. How are you feeling about that?
I'm feeling good.
Okay, all right. So we're going to
Marge Parker was born and raised in a village along the Yukon River. For a 77-year-old woman, she looked quite robust to me. But 8 years ago, her health started deteriorating, and she decided to start taking better care of herself.
I weighed 195 pounds, and I knew that my weight would eventually give me problems. I thought, I want to get rid of this weight. That was my main reason for seeing the doctor.
Look at the horizon.
He helped me get the 50 pounds of weight off, and he's helped me through knee problems.
As you know, the inside of that right knee, the bones are touching one another. She has an incredibly worn out set of knees, like many people her age. We talked early on about her candidacy for having knee replacement. She's been pretty much against that and asked, is there other things I can do to manage this?
Some doctors might be urging her to get that knee replacement.
Well, that's, my job, I think, is to give people their options and to support them. And certainly somebody who wants to run with another approach, I am very in favor of that.
In our villages, you had medicine people all the time, years and years and years ago. It takes both of us. I just think it takes both sides of the world to be together. The doctors here and us here.
Traditional healers like Sarah Smith have deep roots in Alaska Native culture, and doctors trained in Western medicine don't hesitate to refer their patients to them.
As Western doctors, we can use what we know best, and traditional healers can do what they know best, rather than an attitude of our way is the only way.
Where did you learn the art of traditional healing?
I learned how to do this as a child, so I've been doing this as far back as I can remember. The elders in my village really taught me. My elders, a long time ago, they would find a certain heat on you. They would travel with the other hand to find the other heat. That's where you're blocked. And they would unblock that. And he is cooling off. Got release, releasing. With Marge, I work her feet very gentle. And what I'm looking for is, where is she blocked?
No swelling on my knees?
Yeah.
No fluid?
This here is cooling.
I realize that it comes from such a different model than Western medicine. I don't necessarily have to understand it, but if it extends somebody's well-being, then I'm comfortable with that. It's another tool for us to help people get where they want to go.
When you go to the traditional healer, do you feel more in touch with your roots as an Alaskan Native person?
Yes, I do. Traditional medicine provides mind, body, soul, and spirit. I have great faith and trust in traditional healing. I have faith and trust in Western way of medicine. Western medicine doesn't have it all. Traditional healing doesn't have it all. But you combine the two, it's powerful.
After we had settled down and got our primary care access going and people had their own primary care providers, we asked a question of our population. What are your top health needs? Our customer owners said, go after domestic violence, child abuse, child neglect. But going after child abuse and child neglect, domestic violence was not going to be an easy task. People did not want to break silence. This was top secret. This was not talked about in villages.
From the time I was born, I was raised around alcoholism and domestic violence, and I was in and out of foster care, foster homes, and I never did have, a permanent home until the age of 7. There was sexual abuse, emotional abuse. I know that people from every region in our Alaska Native communities have suffered domestic violence and sexual abuse. And that cycle of harm has been a part of the past 3 or 4 generations.
For close to 100 years, federal policies stripped Alaskan Native people of their language and culture. In efforts to forcibly assimilate them, Native Alaskan children were taken from their families and sent to live in boarding schools far from home.
When my mom was 8 years old, she boarded an airplane and she left our community for the first time in her life, and she went to a boarding school along with all the other children. And while she was at boarding school, she was told never to speak a Chupik word, so she had to only speak in English. I asked her, what would happen to you if you did speak a Chupik word? And she said, well, all the children who spoke Yupik and Chupik had duct tape placed over their mouth, and they were lined up in the classroom as an example to the other children not to speak Chupik. And I always looked at it as something all the children went through until I heard an elder in Bethel tell me about the grief that the adults experienced because the village no longer had children in it. All the children were gone. And this elder told me that the whole village fell silent. And the trauma of that, I think, is the beginning of understanding where the domestic violence and sexual abuse comes from.
Today, the amount of violence among Alaska Native people is staggering. The physical and sexual assault, neglect, and mental abuse of Native Alaskan children is more than twice what it is in the rest of the country. And more than twice as many Native Alaskan women are victims of rape than women in other parts of America.
And so we're going after all those who have been harmed and those who are doing the harming. We're not victims. We're not survivors. But we definitely are people who have been harmed. And we have harmed. And so we have been addressing that all and believe it's the root causes of much that has happened in Alaska.
They stripped us of our culture. And that trauma was instilled in us. When I was abused, I was told not to talk about it. That's just the way it was. And so we kept silent. And one of the lies we learned as men, and it's every culture that says this, men don't cry. Men don't ask for help. Well, those are lies. Men do cry. Why do we have tears? Trauma in a person's life eats you up inside when you keep that story bottled in. I was holding in all that anger, all that hate, all that resentment spiritually, and it was eating me away. I mean, I've got high blood pressure. I've had become pre-diabetic. Just look at the rate that our people are committing suicide and the domestic violence that's in the communities. We have to talk about it.
To all who suffered at the hands of another, come out from the pits. Come out from the shame. Well,
The women dance a dance called Rise Up Mighty Warrior, calling out Alaska Native people to break their silence.
Turn to those with love who have only brought you pain. So rise up, mighty warrior, rise up.
We hold 5-day intensive trainings where people share their story for the first time. 8,000 people have gone through our program.
As an adult, I learned to talk about my story. When your spirit hangs on to the lie that I can't amount to anything, I will not succeed, I'm no good, I can't do anything right. Those that were told to you, your spirit grabs onto that, your heart grabs onto that, and you hold on to it and you believe it and you walk it out in life. I carried that. And so when I carried that in my spirit, I gave it to my children. But our spirit is supposed to be free and to be full of love and joy and compassion and be able to help our community to grow into the next generation.
We believe from our past, but nothing but a cruel deception.
So it's all of us walking through trauma together and walking together in wellness. All of us. Health and wellness. We all need to grasp our culture, for those of us who might have lost some of it, to be proud of who we are and not be afraid to say we're Alaska Native.
Rise up, mighty warrior, rise up.
The most important determinant of anyone's health, statistically across the whole population, is the amount of self-confidence they have. The more confident you are, the more you make better decisions for yourself. This is a customer-owned, customer-driven journey. This is built around what Alaska Native people know will work for them to get to a healthier place. So having a strong social fabric, a strong social support, living in community effectively and well is a huge part of the journey.
My vision of wellness for our community is a little girl that maybe is 5 years old, twirling around in a room and not being afraid. She's just free to spin around and be free, not afraid.
You know, my father was a doctor in the 50s, and he didn't have many tools in his black bag, but he spent time with his patients.
The old GP had a lot of things right. The problem is that today medicine is way more complicated. So we need the sophistication of modern medicine with the heart and soul and approach of the country doc put together. We need medical professionals who are teachers, coaches, advisors, and cheerleaders. We need experimentation, dialogue, team-based approaches. We need relationship.
As I traveled across America, I took heart from the medical caregivers I met, practicing modern scientific medicine, fortified by conversation, teamwork, partnership, and trust.
We're all in agreement. Good. We'll see you in 3 weeks, okay? All right.
If only my father could have met them. If only my father could have seen this film.
RX, The Quiet Revolution, is available on DVD. To order, visit shoppbs.org or call 1-800-PLAY-PBS.